Hi, good day to you. This is Dr. Amihan, your humble servant in health in the northern part of Antique. I have to discuss something to you which is very important because dengue cases is rising, especially at this very time of rainy days. So it is very important to diagnose dengue. Even at home, you can actually diagnose this one, and on outpatient basis, meaning to say you can also visit your doctor or clinic or hospital or RHU at your convenient time if you have problem with on and off fever and you are afraid that your patient is having dengue. So this is how to diagnose dengue. You have a criteria, what we call the probable dengue based from the criteria. First is if your patient, if you are living, if your patient is having fever and if you are living in a place where there is a diagnosed case of dengue, or if your patient had a history of travel to areas where there is dengue cases, so and your patient is having fever, plus if your patient is having the symptoms of nausea and vomiting, there is rash, body aches and pains in the body, and if you go to the doctor or in the clinics or in your rural health unit, then you have a positive tourniquet test and you get your complete blood count or CBC, and the result is you have leukopenia, or meaning there is a decrease of your WBC count, then most probably you have dengue. And the most important of all is you have any warning sign. Now the warning sign of dengue is very important because this is, or there are signs that you have to observe in your patient, because this patient is due for admissions in the hospital. If your patient is having warning signs such as abdominal pain or tenderness, meaning there is stomach pain, abdominal pain, there is persistent vomiting, so you have to admit your child because this is prone to develop dehydration. And sometimes you observe patient with fever that there is mucosal bleeding or the beginning bleeding of the gums, and sometimes the nose, or there is a bleeding in, there is blood in the stool, and there is bleeding in some parts of the body. So that is parts of the warning sign, especially mucosal bleeding in the nose and in the mouth. This is very common. And your patient is weak, that is lethargy, and sometimes they are not weak but they are restless. So your patient is cannot relax, they are restless because this is a part of the warning signs of dengue that they have to be admitted. And the abdominal pain is sometimes, when examined by the doctor, there is what we call liver enlargement. So sometimes you will be able to feel pain in the upper quadrant area of your abdomen here, where the liver is situated. So it is a very important findings because there is what we call a congestion of the liver. Okay. Now you can also have fluid accumulation or critical fluid accumulation in the lungs, in your face, in your abdomen, and in your lower extremities. So this is critical fluid accumulations that can be found in the lungs by chest x-rays, and it can be found in the lower parts of the body, in the lower extremities and in abdomen during physical examination by the doctor. Now, if you get a CBC, then and hematocrit and hemoglobin, including that during your CBC request, with your WBC is sometimes increased or decreased. You have your increased hematocrit and hemoglobin count, and sometimes there is a a decrease of your platelet, rapid decrease of your platelet. And this is the things I mentioned to you are warning signs of dengue, and your patient should be admitted. If signs and symptoms persist, you have to go to your doctor. And or if any signs and symptoms that cannot be explained by the parents or by the families to the child or to the person having fever, then you have to go to your doctor for check-up. And you can also go to my clinic for further evaluation. I am very much available in my clinic. So this is Dr. Amihan, your humble servant in health, in a northern part of Antique, wishing you the best of everything, and be alert always and be watchful for these probable dengue signs and symptoms and the warning signs of dengue, because dengue is preventable and it can be managed, especially if we treat the patient in the earliest possible time of the stage of dengue. Okay, so bye and good luck.